name's Peter Steinberg. I'm a urologist at Beth Israel Deaconess Medical Center in Boston. I'd like to talk to you about having an office procedure called a cystoscopy. This is a roughly 60-second procedure where a small camera is placed through the hole you pee through, called the urethra, to look at the lining of the bladder, and in men to look at the inside of the urethra and the prostate. This is usually done to investigate things like blood in the urine, though it can also be done to do things like follow up on some types of procedures done in the bladder and to monitor people for recurrences of diseases like bladder cancer. Most of you are having this test done because you've had blood in the urine, and we want to make sure that the lower part of your urinary tract, the bladder, urethra, and prostate, is normal. Although this procedure sounds incredibly scary and uncomfortable, it's actually really well tolerated, with most people rating it a 2 to 3 out of 10 on the pain scale, which corresponds to mild pain, and many people feel like they need to urinate during the procedure. Preparation for the procedure involves giving a urine sample to make sure there's no evidence of an active infection. We'll give you an antibiotic pill by mouth to prevent a urinary tract infection. You're then placed on your back. Your genitals are cleaned up with antiseptic. A numbing gel is either placed on the scope or directly into the urethra. Then the scope is inserted into the bladder, and on a video monitor, we will inspect the lining of the bladder. During the procedure, I encourage you to watch on the video monitor because this has been proven in multiple studies to reduce the discomfort of the procedure. The scope is then withdrawn, and most people need to urinate because we fill your bladder with fluid. There are very few risks to the procedure, but there are a couple things you need to be aware of. Some people will see visible blood in the urine in the next few days. It's very infrequent that this is heavy. If you see clots of blood or have trouble urinating, please let us know. The other risk is there's a chance of getting an infection in your urine or a urinary tract infection. That risk is approximately 1 in 100. So if you get a fever or a few days later are having burning or frequency of urination, please let us know. Thank you for watching this video, and I look forward to seeing you for your care.